Dentists are one of the riskiest non-hospital jobs during the coronavirus crisis. Now, during the height of the lockdown, dental offices were closed unless it was an emergency situation. But now 40 states are allowing dental offices to resume providing routine care. But it will look very different from what we are all used to. Here to break it all down for dental care is Dr. Cami Haas, co-founder of the Super Dentists. It's the top awarded pediatric dentistry, orthodontics, and parent dentistry group in the U.S. Dr. Haas, welcome to the show. Thank you so much for being here. So talk to us. What
Thanks,
are
Anna.
some of the risks dentists are facing as they reopen, and how are all of you tackling them?
Great question. So obviously, you don't have to be a dentist to know that we work in the mouth and saliva. So obviously, dentists and hygienists and our staff are at a very high risk profession in general. But I think the practical and the real risk is a lot lower than what people think, because we have a unique opportunity in dentistry to make sure that we screen every single person every single day. So that includes our patients, the parents that walk in, our staff, and our doctor, and only allow healthy people inside. That's a little different than our medical colleagues, the nurses, the paramedics, that they actually have to see patients with COVID and other diseases. We have a very, very good process in place already across the country to make sure that we screen those patients on the phone first, and then before they walk in, to make sure we only allow healthy people inside. So that's how we're going to keep everybody safe, including our staff, doctors, and our patients.
Sure, because in your field, there is no social distancing when you see patients. You mentioned this, the screening. Any other safety protocols that we can expect to see in many dental offices as we make our appointments?
Absolutely. So you can definitely expect that things are going to be quite different than what you used to before COVID. So that starts from the phone call. There's going to be a lot of screening questions there. Before you walk in, many offices, like my office, we've created a virtual waiting room or virtual reception room. What that means is that in the comfort of your car, you can check in, you can fill out your digital paperwork, you can even be entertained and educated while you wait. And so all of that gets done in the car, and then we make sure that when you walk in, everybody obviously has to wear a mask. We are going to adhere to social distancing, so what patients can expect is that the lobbies are going to look different. The waiting rooms are going to be maybe more, so patients stand away from each other, not as many seats, and that's what patients should be expected to kind of wait outside a lot more than usual. And that's all the changes just in the waiting room. In the clinical areas, some procedures have been modified to make sure the risk is reduced by, for example, dentistry produces some aerosols, certain procedures. So many of those procedures have been modified to either reduce or eliminate those aerosols. And then we have some technologies to make sure we vacuum out those aerosols before leaving the patient's mouth, again, to keep everybody super safe. I think our patients should remember that dentists in general for 20 years, 30 years, we've dealt with many viruses and many bacteria, many germs and pathogens before, and we have some amazing protocols already in place. And we've added a bunch to make sure that we create a really, really super safe environment for all of our patients, because oral health cannot be neglected always, but especially during a pandemic.
Yeah, that's absolutely right, Dr. Haas. I actually had to cancel my appointment last month, hoping to get back in there soon. And since dentistry is such a higher risk profession now, we are hearing reports that some dentists are actually struggling to find hygienists willing to come back. Have you heard about this? Is it something you've encountered?
Yes, I've heard about it. Actually, I think across the country, I've read surveys about 20 dental offices, or 20% of dental offices may not open. And it's a combination of factors. The fact that financially, many of them have been really ruined because they haven't had any income for about 2 months. And then there's some kind of a fear. But as I said, that fear in theory is high, but in a practical sense is not as high. In fact, I think is very low compared to retail stores or restaurants or even our physician colleagues, because of the factors that I mentioned with the screening and everything. So I think hygienists or dentists or assistants who are listening to this or watching it should remember that this is not in theory. In practical sense, I think going to the dentist is going to be very safe. Probably one could argue is one of the safest places to be indoors is going to be dental offices.
Doctor, I want to ask you one more question before I let you go. One issue that is rarely talked about when it comes to dental hygiene is it is a gateway to many other health issues, including heart and lung disease. Talk to us about the overall importance of oral health. I know you touched on it a few moments ago, but just to reiterate.
That's a wonderful question. I'm so happy you brought it up, because I think because of the fact that the dental profession is usually separate, starting with the dental schools and medical schools, those are two different professions. I think a lot of people, patients and medical colleagues included, we feel like the mouth is just a different part of the body and it doesn't affect the body. But in fact, as you just mentioned, the mouth is the gateway and the opening to the body, and nearly everything that enters the body goes through the mouth, including COVID-19. And so oral health impacts every part of our health, starting from conception, because it impacts fertility and pregnancy health, to death, because it impacts many, many systemic issues, including cardiovascular and lung health. To that effect, you can probably imagine the surfaces of the mouth is contiguous with those of the trachea and lower airway. So whatever happens in the mouth impacts the lung health, which is so critical, including, especially during this time of COVID. So I really, really encourage everybody to visit their dentist. This is not one of those times that you can think, oh, I can wait it out and not go to the dentist until there's a vaccine. Oral health is so critical for the dental health, for the gum health, but also the overall health. So I really encourage everybody to visit their dentist. They should be assured that dental profession in general, they've done an amazing job to keep their offices safe during other pandemics and other viruses, and they're going to do the same thing for this pandemic.
All right, Dr. Kami Haas, thank you so much for being on the show. Be well, good luck, co-founder of the Super Dentist. We appreciate you, sir. Thank you.